joined the National Catholic Bioethics Center in 2017 and was named the Director of Education in 2023. In addition to overseeing the NCBC certification program and other educational offerings, he produces and hosts the NCBC's Bioethics On Air podcast and responds to approximately 400 ethics consultations per year. He also lectures for the NCBC and has authored multiple statements, guides, and book chapters for NCBC publications. He has a number of advanced degrees, I will abbreviate that section there, including a PhD from Marquette University, in addition to a number of other Masters of Education degrees. Personally, he is married to his wife, Susan, and they have a daughter, Maria. Please help me welcome Joe.
Hey everyone, good morning. Good morning. That was pathetic. Good morning. Again, my name is Jozef Zalot, and we're the ethicist and Director of Education for the National Catholic Bioethics Center in Philadelphia. I'm going to talk a little bit about that to begin with, but just a little bit on the title today. So moral courage and mercy in ethics consultations. So what I'd like to do today is talk about, obviously, ethics consultations, because sometimes the most difficult thing that can happen. And I'm not going to tell you how to do an ethics counsel. There's many people doing them, there's many different ways to do them. But what I'd like to do is give you a little bit of, I don't know if it's wisdom, but give you some insight as to what I've learned over the 7 years that I've been at the NCBC, that I've been doing these consults. And right now, to track them, I think my number is just over 2,200 consults in 7 years. So it's quite a bit. My little brain has maybe learned something from there. And I'd like to kind of pass that on to you. And also have some time for some good discussion afterwards as well. A couple things, just want to mention, give a quick overview of the National Catholic Bioethics Center, or NCBC, because I think you'll see that what we're going to be talking about today is really at the heart and soul of our mission. So, speaking of which, the NCBC, our mission statement says this: the mission of the National Catholic Bioethics Center is to provide education, guidance. I underscore the underlying guidance here, because that's really what an ethics consultation is. It's guidance and resources to the church and society to uphold the dignity of the human person in healthcare and bioethical research, where that sounds like the theme of this conference here, thereby sharing the ministry of Jesus Christ in His church. And so that's our mission, and that's, when we're providing ethics consults, that's the context within which we're seeking to do it. Right? So what is the NCBC? You can see, well, we're a think tank for issues of healthcare and life sciences. My wife laughs at me. She says, you realize you get paid to think? And if you knew me, that's actually pretty scary. In a lot of different ways. As you can see, we're founded in 1972. One of our claim to fame, we were founded before we were related, and we exist after it. So I guess that's a good thing in some ways. Located just outside of Philadelphia, Pennsylvania. We used to be in Philadelphia, but thank goodness we sold the big old house that was falling down, and now we don't have to pay Philadelphia wage tax, so that's a great thing. But so we're actually in Broomall, Pennsylvania, which is just outside of Philadelphia. So our staff, we have a staff of approximately 20, including Claire, who's sitting right here. She's our latest hire. She's in our development department. We have a staff of about 20. We have 7 full-time ethicists right now and 2 part-time ethicists. And our former emeritus president, John Haas, think about that for a second, says that he doesn't know any other organization that has that many PhD-trained ethicists. So there's the clan right there, all of our lovely love shots. Those came from FBI wanted posts. So what do we do? And I kind of mentioned it in the mission statement. But what our purpose is to promote and safeguard human dignity from conception, fertilization, spermic fusion, whichever term you want to use, until natural death. And that's what we seek to do. We adhere very strongly, we adhere to the moral teachings of the Catholic Church. We're very faithful to the magisterium. You'll see some examples of why that is in a few seconds. But we use the ERDs, and I know those in the master's program know that the ERDs are the Ethical and Religious Directives for Catholic Healthcare Services. Document put out by the U.S. Conference of Catholic Bishops that talks about how we should provide healthcare in a Catholic setting. And in fact, our consult, you'll see a little pie chart in a couple minutes. We track our consults based on ERD directives. So there's 77 directives of the ERDs. And so we track them that way, so we have a good idea of what are the topics that people are asking us about. Right? So we adhere to more teachings of the church, and what we seek to do is to help people not only understand, but apply this teaching to very practical challenges and issues that they face in healthcare. Right? So a lot of people know what the church teaches on different topics. We try to educate, well, why does the church teach what it does? And then what does that mean for your particular situation? Right? And again, going back to John Haas, our president, he has a famous line that, you know, if you've done one ethics consult, you've done one ethics consult. Because they are all different. I suppose it's like you hear one confession, you've heard one confession. No. All right, whatever. So our primary activities, that one just blew up in my face. I appreciate that. I'll get you back. So our primary activities are 3: publication, education, and consultation. Just mention a few things about all 3 of them. And again, consultation is ongoing because that's what we're going to focus on today. So really quickly, in terms of our publications, and actually I've got a whole suitcase full of stuff back there from our table here, so anything anybody's interested in anything. But we do a number of things in terms of publications. We have a quarterly journal that, guess what, comes out quarterly. Very good. All right, it's the National Catholic Bioethics Quarterly. We have our Ethics and Medics, which is our monthly publication. The quarterly is more of our academic journal. It's an academic journal. Ethics and Medics is really sort of more popular things or more ethical things, like explaining different things that have come out on different topics. So we have a number of books. I just have a few examples here. You can see our Catholic Healthcare Ethics and Manual for Practitioners. That's kind of our overall guide. The big book covers a lot of different things. And you can see some of the others as well here. So we do publish books. We also publish, and I'm actually really proud of these, we publish a number of guides. These are very practically oriented guides for people. And again, I've got some copies here if people are interested. I just want to mention 3 in particular. We have our end-of-life decision-making guide, which has the boxing form, the advanced right. We also have our guide to palliative care and hospice. And something I'm really proud of in this one is in that guide, there's an insert of questions to ask, and we get this consult a lot about hospice. Questions to ask a hospice, questions to ask before enrolling a loved one in hospice. And I think there's 14 or 15 questions, and we send that to people. And I've heard ethicists in the Catholic healthcare system saying, gee, I wish we had this. I wish I had this when my mother was going into hospice. So I'm actually really proud of that. And then we also have it on the NCBC guide to POLST, Physician Orders for Life-Sustaining Treatment, and we have a salary POLST form there. So these are some of the publications. We do academic things, but we do very practical publications as well too. And I really like the practical stuff because I got the practical mind. I'm not the deep thinker. I always tell people I'm not the deep thinker. I'm the practical guy. In terms of education, we do a number of different things. I mentioned before that we are very faithful to the magisterium of the church. Well, we sort of have to be because every 2 years we have a workshop for bishops. And so every other February, so the next one will be February of 2026, we invite bishops from the United States, Canada, Mexico, Central America, down to South America, the Caribbean. At our last one, we actually had the Cardinal Archbishop of Addis Ababa, Ethiopia, was in attendance. So we bring bishops together for 3 days and drink some beer and wine, but at the same time, we educate them on certification for fire. So it really is a wonderful workshop. It's very relaxed. And by the way, the ships are real guys. We also have our certification program, which is our 9-month program. We have actually partnered with Mary on that. The first year of Mary's for people outside, undergraduates in Mary, there's a track in the college itself. But for those who are outside of Mary, the first year of their master's program is the NCBC certification program. And we have seminars available for presentations and things. And we'll take it on the road. And one other thing I do want to mention, just because my role as director of education, if there are any educators here, particularly like high school educators, if you're aware of this, or you know of people, we are starting we're actually piloting it right now, an undergraduate Catholic healthcare ethics course for high school students. Right? It's you can get college credit for it. Right? So if anybody's interested, or if you know anybody who may be interested, please let me know. Right? So education. Consultation, this is going to get us into what we're really going to be talking about today. So the NCBC, we have a 24/7 consultation service. Right? There is someone available 24 hours a day, 365 days a year. So the way we do it is we have people on duty during the day, 9 to 5 Eastern, and then but always someone is available in the evenings and on weekends. So I'm not on, so feel free to call today. And, I don't know who's actually find out who's on, let you know to do it, but we have someone available 24/7, right? And you can access it either through that phone number there or go to our website and just click on the personal consultation button. So that's individual. We also do institutional consultations. That's not going to be so relevant for us today, but we do, again, consultations with organizations, usually Catholic healthcare organizations, on issues as you can see, mergers or collaborative arrangements, or our Catholic identity and ethics review. Right? So the consultations has a couple of different levels. What are some of the topics? Again, now we'll sort of kind of transition to our presentation today. So I asked I know you probably can't see it because it's a little bit small, but I asked our Director of Personal Consultations, his name is Gianna Medical Professionals. I said, John, can you give some updated, some data about what our consults are? Like, what are the topics? So as I said, we track them by ERD number. So what is it what are the topics? And from, point towards it there, but it doesn't work on this screen. That's interesting. Whatever. From June of 2022, so we restarted our personal consultation department in June of 2022. And so for about 2 years, this is about 2 years of data right here. So you probably can't see, so I'll read it for you. The green piece of the pie, about 28% says care for the elderly, seriously ill, or dying. So for those of you who are aware of the Alzheimer's religious directives, this is part 5 on end of life care. Right? Actually, that 28% is actually down a bit. It used to be around 40%. It's not meaning we're getting less consults. It just means we're getting a broader scope of them. Moving up, the pink, medical interventions during pregnancy. We're getting more and more of those, particularly questions about ectopic pregnancy, things like that. Procreative methods, 8%. That you're probably talking about assisted reproductive technologies. What are permissible, what are not permissible? Conjugal acts, marital act, contraception, sterilization, NFP, about 15%. Jumping over to the other yellow, informed consent issues, about 3%. Biomedical research and experimentation, only 1%. Because Paul's not calling. But notice, or I don't know if you can notice, I don't know if you can see it, but the blue one right here, 22% is cooperation with evil. Paul was mentioning before. And I can tell you, at least for myself personally, that cooperation with evil has increased dramatically since COVID. Really, really interesting. I don't even get people calling us up asking about COVID-19. We were getting calls from researchers saying, what's going on? Right? I actually had one with a lab, the head of a lab. So it was a really, really interesting conversation. So you see, we have consultations on a whole number of different things. Three things. So I said, we're going to be talking about consultations. I recognize that probably people in this room, most of the people in this room don't work for the NCBC. Except for that. All right? So the context within which you're going to be doing ethics consultations, if you're going to be doing them, is going to be a little bit different from the context that we do. So I want to point that out right from the very beginning, so kind of differentiate that a little bit. Secondly, talk about, and you put this in your quotes, prerequisites for doing an ethics consultation. What is it that you have to have in your toolbox, so to speak, to be able to do a good, or to be able to provide this service to patients, or quite often patients' family members. And then thirdly, what are some strategies that healthcare professionals, and you see HCP then healthcare professionals, what are some strategies that healthcare professionals can adopt in doing ethics consultation, or when people ask you questions, right? So it's really not how to do it, but what are things to keep in mind when you're in that situation. All right, so what are some of the differences in ethics consultations from an NCBC perspective versus an institutional perspective? We're talking hospital, nursing home, that type of thing. Even clinics as well. Right? And some of this comes from a joint presentation I did with an ethicist named Elliot Bedford back at the Jozef Medical Association Conference back in 2022. Elliot's a great guy. He is the director of ethics for Ascension Health in Indianapolis, or in all of Indiana. I'm sorry, he's based at St. Vincent Hospital in Indianapolis. He also oversees ethics in Oklahoma. I don't know where you get Indiana and Oklahoma together, but that's Ascension, that's not us. But Elliot's a great guy. And we did a joint presentation back then. And what are some of the differences between institutional consultations and NCBC consultations? And as Elliot would say, in an institutional sense, and this is where you guys are going to be, most likely, right? You're going to be dealing with a much greater scope of consults, right? You're going to be working with really diverse audiences, right? And as Elliot said here, the big challenge is, and this is essentially a quote from him, translating Catholic medical ethics so that it's understandable and applicable in a pluralistic society. And one of the speakers yesterday talked about, I think maybe Ashley, did you talk about this yesterday? Which topic? I don't know, one of the speakers yesterday, I think Ashley Fernandez talked about this a little bit ago. I'm getting the nod from, I'll go to these guys. Yeah. All right? Yeah, and that's a great challenge. Because you're dealing with people with all kinds of religious beliefs or no religious beliefs. And how do you translate Catholic teaching, Catholic medical ethics in those situations? And Elliot would say that can be very, very challenging. From our perspective, we're actually, and what? I really am. Because those who contact us, I'm going to guess north of 99% of them are Catholic. So they believe similarly to what we believe. They have the same values. They're really calling us in a lot of cases because what they want to do, as you can see, I want to do the right thing. I just don't know what the right thing is. Right? Can you help me? I don't want to sin. I don't want to go to hell. I've heard that actually. I'm going to make these decisions, but I don't want to go to hell. Right? So that's going to be a difference, right? And to be honest with you, I think it makes consults easier for us in a lot of ways. Right? So you guys are, the people are going to be doing ethics consults, particularly in secular settings. It can be a more difficult challenge to do, and I get it. I recognize that. Right? A couple other differences really quickly from the institutional side to the NCBC side. So, as Elliot said, oftentimes what they do in his hospital setting is their ethicists are working upstream, right? What they're seeking to do, and Elliot will talk about this a lot more, they're seeking to empower bedside providers to really sort of initiate those consults or talk or even sometimes head off the consults, right? To address the issue before they get to be a crisis. right? So what they're seeking to do is, as he said, work upstream. They're trying to head off ethical dilemmas before they occur, and they're really empowering you guys, right? Particularly nurses. By the way, I love nurses. I'm going to come back to nurses in a little bit. All right? And, you know, in light of that, there's more than interaction with medical professionals than we necessarily need to do. From our perspective, right, we're not, people don't call us when they're trying to head off an ethical dilemma. They're in one, right? Or as I like to say, you know, we get calls when the excrement has intersected the atmospheric circulatory belt. You need a translation of that? I'll let you stew on that one. Yeah. So when people call us, this is really in the moment, right? Something has happened. Right? And this is the problem when my phone goes off at 2 o'clock in the morning. You know something has happened. Right? And someone is looking for, you know, they are looking for guidance in the moment. And a decision oftentimes has to be made. Actually, oftentimes a decision necessarily doesn't have to be made right away, but they need information and need guidance. Right? Now that's not to say that we don't do consults with physicians, nurses, other medical professionals. We do. Right? We do get calls from doctors, from nurses, from respiratory therapists, from all the way down the line. Right? But really, most of the people that we're dealing with are patients, or actually most likely patients' families. Because if people are asking questions, usually the patient's not decisional. Right? The patient is relying on others to make decisions for them. Right? So those are some of the differences. All right, what are some of the prerequisites? Right? What are the things that, kind of, in my experience, what is it that, you know, people say, hey Joe, what would you say to someone who wants to get into the world of ethics and or, you know, do ethics consultations and help people? What is it that they need to know? All right, or what is it they need to be aware of? So, a few things. One is, well, have an understanding of a number of different things. One is, have at least a basic understanding of Catholic healthcare ethics. Right? What does that mean? We'll have a basic understanding of the principles, teachings, whatever, right, that form Catholic healthcare. As you can see, some of the examples up here, the ethical and religious directives, as we said, the new charter for healthcare workers, various documents. I should give somebody $1 if they know what the abbreviations there are, but I don't chip the city here, so I'd probably lose my $1. But Dignitas, Donna Vitae, sorry, Evangelium Vitae, Dignitas Personae, Paul mentioned, Samaritanus Bonus. These are documents that the church has put up on various issues, but are authoritative and can very much help us. You don't need to have a PhD, although it helps, right? But have a basic understanding of what the church teaches. Unfortunately, a lot of people don't. And I don't know, Chip is sitting here, and I know you've been on ethics committees as well too. My experience working with ethics committees is that many members of ethics committees, especially doctors, did I say that out loud? Really don't have a good grasp of Catholic healthcare ethics, right? So have some understanding of that. It's essential. It really is, right? But also say this, right? If you're going to be doing ethics consults, have an understanding of the ethical standards of your professional organization. I just did the ANA up there. So how many nursing students are there? There's a few. All right? It's like, put your hands up. It's like, I can't see this. All right? Understand as I said, the ethical standards of your professional organizations, but also keep in mind this. This is why it's invited. Sometimes those standards do not align with Catholic teaching. And I just pick on the American Nursing Association here because their code of ethics. A few years ago, they went from opposed to assisted suicide to neutral on assisted suicide. Now, apparently, someone has told me, I can't confirm this because I haven't seen it, but apparently the American Nursing Association is going to I don't know if it's a support of assisted suicide, but it's moving away from neutrality more towards outright support. And it's like, problematic, right? But understand those ethical standards. Also, and I can't underscore this enough, and some of you may have been at Megan Kreff's presentation yesterday when all of that baloney, and that's a nice term for it, was going on. One of the things that what you really need to know, what are the standards, what are the policies concerning conscious protection that you have at Providence Health? Get those. I would encourage any of you, if and when you're working somewhere now, or you're working somewhere in the future, go to HR and get the policies that institution has for conscious protection or religious liberty protection. Have that. Understand it. Again, because most people don't know, right? But again, the policies of your institution, be careful because they may or they may not be compatible with the application. Right? Be aware, right? Know what those policies are. I would also say, and again, it's like, oh my goodness, Joe, you're telling me I gotta do all this stuff. Have a basic awareness of the law. Right? What do federal and state laws afford you in terms of conscience protection, in terms of religious liberty protection? And there's a lot of good stuff out there, right? I don't want to go into detail about it now, because it's not really what the presentation is about. But there's very strong protections for healthcare professionals on a number of different things, particularly abortion. Okay? Know that, understand that, right? And it can be very powerful when someone's telling you you have to do something, and you say, actually, no, federal law says this. Be very good. Also, when you're thinking about doing this, or when you're moving into this, have an awareness of your own limits. Right? What is it that you will do? What is it that you won't do? Or as a presenter last year, I can't remember her name, she was the director of nursing, the nursing program at Catholic University of America. She spoke at this conference last year, and I remember she said this: what's the line beyond which you will resign? Where are you in terms of these various issues? And I think this is really important that you're seeing where you are if you're going to be walking with or accompanying others in terms of making very important, sometimes even life or death decisions. Great. So, also prerequisites. Did I spell that right? Yeah, prerequisites. Is that correct? It doesn't look right. Is it right? It just looks wrong to me. Anyway. Also, you should have an understanding of the healthcare professional's role in decision making. Right? What is an ethics conflict? What is not an ethics conflict? What's the role of the healthcare professional? What's not the role in the healthcare professional? Right? And Elliot says this, and I love this, and I think this is probably more for the physicians who are on it. Any physicians here? All right? I think Elliot was a little big on physicians, and he said, I think it's a great point. Know the difference between a medical opinion and an ethical recommendation. They're two different things, right? Have that understanding, but I think for nurses as well too. What's the difference between a medical opinion on something and an ethical recommendation? So although the two may be harmless, they may not be. Secondly, right, and big thing to keep in mind, right, when you're providing an ethics consultation, helping someone to make an ethical decision, your role is not to make the decision for them. Your role is not to tell them what to do. Right? Unless, and this has happened a couple times, unless what the person or the family member wants to do is blatantly immoral or intrinsically immoral. Sometimes we'll get calls from people that obviously got to maintain confidentiality here, but we'll get calls, pregnancy complications, where a woman, a mother, is being told to have this directly end the life of their child. Like, whoa, I know. Questions sometimes about feeding, but I had to say this a couple of times like saying it, but sometimes you have to get down to the end, you just have to do it. So you're okay starving your mother to death. People go, oh, I didn't thought of it that way. Sometimes you gotta go with it, right? It's very, very rare. Your role is not to decide necessarily what to do, right? Your role, we'll see in a minute, is more of a consultant, right? What are some things that you do in an ethics consultation? Well, it's here. Sort of identifying those norms, those principles, those teachings. Sometimes applicable law, sometimes policies, sometimes medical intervention. We're bringing all of these things to the case. And as Elliot would say here, have the disposition to translate the theoretical into the particular within the medical setting. So what you're doing is you're saying, okay, here's a particular case, here's the A, B, C, D, E, F, and G. Here's what's going on. What teachings, what principles, what laws are appropriate or are relevant for this particular situation? And then bring that into the conversation. This is all part of forming conscience. Because oftentimes that's kind of what you're helping people do, is to form their conscience in terms of making decisions. Right? Fourthly, and this may be the most important part, at least the most practical, most important practical part of the ethics consultation, is to clearly formulate what's the ethics question. What's the actual question in this particular case? And you can kind of do it with this kind of template. Given X, is it permissible or impermissible to do Y? Given grandma's, 95-year-old grandma's advanced dementia, she stopped eating, and the litany of other healthcare issues that are going on with her. Given all of that, is it permissible or impermissible to withhold the feeding tube? Right? We get that question a lot, the advanced dementia and feeding. Right? Given X, is it permissible or impermissible to do Y? Sometimes formulating that question, oftentimes formulating that question brings a lot of clarity to the situation. I encourage you to always think of that in terms of doing the consult. Fifthly, as a prerequisite, be able to then, right, to offer a range of ethically appropriate interventions or non-interventions. Right? What does this mean? I use this for anybody who's in our certification program now, or goes into it. In the video lectures, I tend to come back to this image. Medical ethics, think of it as a bowling alley. You've all been bowling, right? Oh, you guys are tough. You've been bowling, right? Yeah, thank you. All right, very nice. Make sure you guys are paying attention. All right? So, you go bowling, you got the bowling alley. And I don't know, how wide is the bowling alley? I don't know, it's like 3-4 feet, something like that. I don't know. Right? And people have the ability to bend the ball and do all this. I can't do any of that. Right? Right? But there's a lot of room for you to work in terms of rolling the ball down the lane. Well, really, in a lot of ethical challenges, particularly end of life, particularly with the end of life, the church allows for a range of decisions to be made. Right? There's sometimes a fairly wide lane by which you can make decisions. However, what's also on each side of the lane? The gutter. Yeah, you don't want to go in the gutter. I go in the gutter quite a bit. Right? The gutter is, you don't want to go there. Right? The gutter here is you're making medical decisions that are more. Right? So for dopes like me who can't vote, or for children who are 3 years old, what do you do when you're bowling? You put down the gutter guards, or the bumpers, or whatever you call it. Loose metaphor here, but kind of think about Catholic healthcare ethics as a gutter guard. Right? There's a range, there's a range of possibilities, or there's a breadth of possibilities, but there's also stuff that is can't go there. And that's what ethics seeks to do, is kind of keep you in that lane, in that bowling lane. Right? And so that's what, going into an ethics consultation, whenever I get a phone call, any phone message, or when the phone rings in the middle of the night on a consult duty, I never pick it up, never answer it. Because I want to hear what the person says. Right, the person leaves, it's all, there's a script and they'll leave a message and all this other stuff. I want to hear what the issue is. And usually I'll listen to it more than once. Actually, at 2 o'clock in the morning, you have to listen to it more than once to understand what's going on. But even during the day, when someone calls in, I'll always listen to the voicemail message. Why? So I can start to do these things in my head. All right, here's the situation, here's what's going on. What are the relevant principles? What are the relevant norms? What's the, at least potentially, what's the range of options that we have? What are the pitfalls? Where do I have to put the gutter, or at least where do I think I'm going to put the gutter guards in? So I'm kind of prepared to do this. This is what I'm talking about, sort of the prerequisites for doing it. Right? And then lastly, and this is particularly for nurses because I tell this to people all the time. Medical professionals, be a resource for trusted medical information and guidance for determining a patient's best interests. As I said, I've had 2,200 plus ethics consultations. A lot of them are phone conversations. And people, I always tell people that in order to make good ethical decisions in medicine, you first need to have good medical information. If you don't have good medical information, you can't make a good ethical decision. You need to get medical information. Where do you get it? I tell people, go to the nurses. I'm not trying to trash on doctors. Yeah. I really am. Because I'll tell people, I say, doctors come in, they join the rounds, they spend 10 minutes with their loved one, and then they go on to the next patient. I'm like, yeah, I know. It's like, keep it in your douche. They do. They do. So what I tell people is, listen, there are other sources of getting good medical knowledge. But I always say, you know what? Go to the nurses. Okay? Particularly those who have a lot of experience. Because guess what? They've done this many times. They've seen, granted that the details are going to be different. The details are going to be different. Okay? But they've seen your loved one's condition many times. And they've got a pretty good idea of where this is going, for good or for bad. Talk to the nurses. And I always tell them, I said, ask them this question. The first day was, I'm not going to hold you to anything, or, this, I recognize this is not a diagnosis or anything else. But in your experience, what's the trajectory of my loved one's illness? What is the trajectory, of my loved one's illness and injury? What can we expect? And nurses, you guys play a huge role in helping people make very important decisions just by speaking truth to them. We're going to get to that in a little bit. Right? So be ready for that and willing to do that. You may be helping in an ethics consultation without necessarily knowing. But that's a good thing. Right? Some of the prerequisites. One other thing. Understand the true meaning of love. That was mentioned a little bit earlier today too. From the Catholic perspective, and it's not just the Catholic perspective, this goes back to Aristotle and not before. What is love? I know there's a song in the 80s. Who sings that? Somebody look it up. Alright? Love is not what our culture tells us it is. Love is not a feeling.
Tattling.
What is it?
Tattling.
Tattling?
That's a song.
Don't hurt me. This is being recorded, isn't it? What an embarrassment. Anyway, love is not a feeling. Love is a choice. Like, love is actually a virtue. Christian charity, it's a virtue. Right? And it's defined as willing the good of the other. It's a little funny story. It's actually a really funny story. I used to teach a marriage class back many years ago. I was teaching at a small college in Cincinnati, and we always started the year talking about, these philosophical, what is love, this along. And we go around the room at the beginning of the class, the first day of class, people would, say who they are and what they were doing. It was a young woman, I forgot her name, we'll call her Joyce. She said, my name is Joyce, I'm getting married in 6 weeks. We're like, oh, cool, awesome. And then we proceeded with the class, and so we talked about this, what is love, and love is willing to go to the other, and the love at the foundation of marriage is not a feeling or lust or whatever the case may be. It's the decision to will to go to the other. And we hammered that home for a couple of weeks. So we get to about spring break, and I remember she came to class one day and I said, Joyce, aren't you getting married? And she goes, yeah, I called her. I said, why? And she goes, because I took this class. And I said, is that a good thing? And she goes, oh yeah. Oh, yeah. So, well, it's a choice, right? Willing to go to the other, right? When we're talking ethics consults, this understanding of willing to go to the other has to be at the forefront. Do I do it all the time? No, I don't. I get ticked off. Why is it you're on consult duty all day, it's Friday afternoon, you're tired, you want to go home, this never happens to doctors as well. 2 consults come in after 4:30. Just but get it over. Yeah, will we go to the other? All right? That's the key to this. All right? How am I willing to do good in terms of this ethics consult? Right? And the key to this, I think, is speaking the truth. Someone mentioned it before. Right? Speaking the truth. How do I love someone? I speak the truth to them. We were having a conversation this morning. But speak the truth to people. Right? And that's how you love them. Right? Even when it's not popular, even when it's difficult, even when it's uncomfortable. Have I ever been in situations where it would be really easy to tell a person, yeah, just go ahead and do this? It would be, oh yeah. Oh yeah. It would be. Right? It's like, no. Right? You need to stand up for what you believe. Right? It takes a little bit of fortitude, it takes a little bit of strength to do it. Right? But this is what we need to do. You have to have the ability to speak the truth to people. Right? In light of this, just some things to be aware of. And this is kind of the opposite of what I just said. Because the temptation is there. I would ask another question. I've heard people say, I'm not saying it, but I've heard people say that physicians will, like other people, sometimes they'll just take the easy route in terms of treating everything. It's a lot easier to give them this hormonal medication than to find out what's actually the causes. Right? Affirming whatever the other decides or going along with the group or family for the sake of peace. Oh, that happens too. Oh yeah, family dynamics, and ethics consults, a lot of love sometimes. Right? Affirming or going along with, that's not love. Right? That's not speaking the truth to someone. Right? Be aware of that. Be aware also, kind of in line with this, of ethics of shopping. You'll get people doing this. Sometimes people will call us up and you really get the thought that they, tell me what I want to hear. It's sort of like priest shopping, I guess, sometimes. Tell me what I want to hear. Or we've had situations where, and I think this is actually something that happened relatively recently, again, I can go into detail about it, but a person contacted our office, contacted 2 different ethicists, and based on information given, got 2 slightly different answers. And then this person went back to those that they had a disagreement with and said, look, man, 2 different NCBC ethicists said 2 different things. You've got to speak the truth. Right? Be aware of it. Also be aware, too, that sometimes, and this has happened to me, you're in a conversation with someone and they seem really resistant. Right? They're like, they seem to be resistant to what you're saying, in terms from a Catholic perspective, how do we make decisions here? But then at the end of the conversation, they'll say, hey Joe, thanks, that's exactly what I needed to hear. never really know. The key to all of this is, again, if you truly will the person good, you have to be truthful, right? And we can't give up. Somebody said, this was Ashley yesterday, said between good and evil, there's really no middle point. Right? And that's what we have to do. We have to have the strength to do that. All right, so the last part, what are some practical strategies that healthcare professionals, you guys can adopt in consultations with patients and caregivers? Again, this is going to be kind of personal to me. Things that I've found that works, take what you will, reject what doesn't work for you. But some of the strategies, right? What I've always found really important to do is to create an atmosphere where people feel empowered to be able to express what it is, express the issues and express their concerns with things. It is, you can hear it, it is palpable, particularly when people call, right? Particularly in an acute situation. There is a whole lot of stress, a whole lot of fear, a whole lot of anxiety, a whole lot of uncertainty. They're like, oh crap, right? My loved one 12 hours ago was perfectly healthy, and now they've just suffered a massive stroke. I wasn't prepared for this, right? And they are just completely confused, right? And sometimes they're being called on, maybe even pressured, to make decisions that literally can have life or death consequences, right? They're being called on to make these decisions, as I say up here, in an environment over which they have no experience, no control. A healthcare environment is really intimidating for people who are not nurses. I mean, imagine living your life, doing whatever, and all of a sudden, you're in an emergency room where things are beeping, and people are running around and doing this and that. It's like, right? And this is what people want, right? So and another thing to try to do is power dynamic, right? Because there certainly is one between the healthcare professionals and the requesters. As I mentioned before, usually the requesters, from our perspective anyway, they really have no experience, no knowledge of medicine. They're very vulnerable. Right? And healthcare professionals, and again, I'm picking more on positions here, they have the medical knowledge. Can they be paternalistic in it? Yes, I can. Or at least perceived to be. We hear that. We do hear that. And also, I kind of mentioned this before, do all healthcare professionals have really an adequate knowledge of Catholic healthcare ethics? From my experience, no. I've seen it on other students. Right? So you've got this power dynamic whereby you have medical professionals who have the knowledge, but also may not have the background in making critical decisions that at least this particular patient is looking for. Right? So address that, understand that dynamic is at work, and that's affecting the request, or may be affecting the healthcare professional as well too. Keep that in mind. Right? Within the consult, most important rule. Joe's rule number 1. Shut up. Right? I can't offer any kind of advice, guidance, whatever, until I understand what's going on. Right? And the only way I can understand, and I recognize too that there's a bias as well, because I'm only getting the perspective of the requester. There's other perspectives here as well too. But shut up, Joe. Listen. Right? Why is that? Well, some people, it takes time. Right? Imagine someone, I'm sure many people in medical, who are in the medical profession have experienced patients who are, well, they're confused, they're fearful, right? They don't understand what's going on. Right? It's going to take them some time to express that. And I always ask people, my wife was a pre-K teacher. Use your words with the kids. It's kind of the same thing. In your words, tell me what's going on in your words. And you've got to give people time to do that. Now sometimes, yes, does it happen that people start giving you their whole life history? Yes, that happens. And then you got to say, focus, Joyce, focus. focus. I don't need to know about your uncle who died from diabetes. I just, it's not important, right? But shut up and listen. Right? First thing. Second thing, always be objective, right? At least initially, right? And what I've done with people, they're some really difficult situations, and I'll tell them, I say, listen, right now for the next few minutes, I just want you to know, right? I'm not trying to be a jerk, I'm not trying to be anything else, but I'm going to ask you some very, as I say, I'm going to ask you some very dispassionate, pointed questions, right? Because I need to get some information. And people are all like, please do, yes, no problem. And try to be as objective as possible to get that information for me. Right? Be prepared sometimes. Be prepared for an exercise in conscience formation, because that's what's really happening here. You're helping this person to form their conscience, as Paul said the other day. This was not, we did not get together and talk about this, but during COVID, our consults shot up from what would be about 1,500 a year to over 4,000 a year. It was ridiculous. I hated being on consults during COVID because all you would get is COVID consults, and I get like 30 a day. And it was nuts. It was one time, I was telling people I think yesterday, it was one time, height of COVID, all COVID consults. I had one, it was in withdrawal from the ventilator. And I was like, thank you. And the person on the phone was laughing because she's like, yeah, I get it. But I wish I had $1 for every person who said, Joe, just tell me, should I get a COVID vaccine or not? I said, I can't answer that question. You have to answer that based on all the information that was given. Right? But this happens. Right? You're actually helping someone to form their conscience in terms of making these decisions. You don't know something? And going along with that, if you're in over your head, seek help. I do that. We've had consults come in where I go, that's a good question. I'm always amazed. Actually, I've stopped being amazed, but I'm always surprised that the new things that are coming in. It's amazing. And sometimes things are coming in, like, I have no idea. And then I'll go to somewhere else. We'll have a little, convene a little powwow and talk about it. But don't be afraid to do that. Don't be afraid to go and get help from any number of different places. Go to your hospital or system offices. You can go to CHIP if you work for Christus. And don't. You can contact the NCBC, and there's others as well. No, just a good guy. And lastly on this, I think this is last, I've come to realize this over the years. It took a while. Many people already know the answer. And what they're looking for from you is an objective ear to talk things out with, or a confirmation that what they're thinking about doing is the morally correct action. That happens so often in end-of-life care. People are like, they're all confused, but their moral intuitions are actually very good. So I always tell people, trust your moral intuitions. Because most of the time, at least in my experience, people's moral intuitions are correct. And really what they need is kind of a little bit of handholding. And I don't mean that in a pejorative sense, but just a confirmation that, yeah, what you're doing is morally permissible. And then, people are worried about, oh my goodness, am I committing a sin or something? I say, listen, right? You're in a situation that's very, very difficult. I mean, decision to withdraw a ventilator, right? Or not initiate it, something like that. I said, listen, we always have to look at the best interest of your patient, given everything going on. I said, listen, at the end of your life, right, you're going to stand in front of God, right? And you're going to have to give an accounting for your life. Can you stand in front of God and say, God, with the information I have, this was the best decision I could make for my life? And 99 times out of 100, the person says, yes. Because that's all you have. This is the reality. And it's actually a very positive reality. I really, really like this. So practical considerations, all right? I would always say this, and you probably do with patients as well too. Always ask, you know, if a loved one is calling on behalf of or a family member is calling on behalf of a loved one, always ask for that person. Don't refer to them as sort of a patient, but refer to them as Paul. Okay? That's always a good thing. Empathize with the patient's or the family member's confusion, hesitation, or fear. So I have this dad situation. So this was really interesting. I learned a lot from this. So again, I've been at the NCBC for 2017 to 2022, almost 5 years, and done hundreds of practice consultations. Then my own father became a patient. Right? I was his healthcare power of attorney. Actually, my mother was, but she said, any decisions have to be made. And he ultimately died May 10th of 2022. But it was a pulmonary condition. That was what was going on. And it never got to the point where we had to make, some really important medical decisions. But it could have. And it was the most bizarre thing. Because knowing that I was this healthcare power of attorney, I was like, oh crap, what do I do? Literally, like, what do I do? And then my head's going, so you have people, all right? You've had this conversation with people a zillion times. What's different about this? What's different about it is it's my father. And that made me realize, oh crap, when I'm talking to these people, this is their loved one, just like this is their father. And it gave me a whole different perspective when I'm doing that example. I mean, I do it perfectly? No. But it's like, whoa. I kind of get it. Right? So empathize with them. And then just a couple other things really quickly. Sometimes, and this happens, the ethical challenge or the ethical issue arises because of someone's immoral decision. And I can remember one person in particular, she called me up, she was in the situation she was in because of a horrible decision. And she said, Joe, I don't want you to judge me. And I'm like, listen, go back to Joyce. It wasn't Joyce, it wasn't the same person. I was like, Joyce, listen, have you dealt with this in Sacramento Church? Yes. I said, look, then that's done, right? And now let's talk about practical things. I said, listen, I'm a sinner. I am in no position to judge you, right? You've taken care of that in Sacramento confession. Let's now figure out what's moving forward. And you could just hear it over the phone, just relax. Right? This happens as well too. Use humor when appropriate. For people who know me, tend to be kind of jokers. It works. And again, I know not all people are going to do that, but sometimes, particularly if it's a really tough conversation, a well-placed, stupid line, or some stupid reference to like what is love or something like that, it actually works in that extension. Offer to pray for Christ, which I do. And also close the loop, like always often follow up. When people call me, we're on duty for a day. Something may come up tomorrow, and I'll say, please myself for That's it. I think that's it. Yeah, so for contact information, again, website, our NCBC website is there. It's the phone number for our consult line. That's that's me. There's contact information. I actually have this written up in notes.